Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408-687-1899. As you know, we are discussing about the structure formation of this body, and the structural formation of this body is a constructed by bones, different bones are making their joints, and ultimately joints are making a skeleton type things, and these skeleton type things are covered by the musculatures, muscles, and these muscles at their end. Every muscle has its origin and insertion. When a muscle originates from somewhere from the bony projections, it originates like fingers, like different places, small different places. Just like on the high mountains, when the ice melts, it goes down in the shape of water from different places. And ultimately, when it goes down at the base of the mountain, it is converted into delta. Most of the rows of these waters are uniting each other and makes a delta, and after that, delta water flows in one direction, and that is known as river. In this way, when a muscle, first of all, when we're talking about the skeleton has bones, and bones are having two ends. Every bone has its two ends mostly, because there are different kinds of bones. The long bones mostly are having two ends. The one is known as proximal end, and the other one is known as distal end. All the ends which are very close to the center of the body, with are closing to the center main line of the body, they all are considered the proximal ends of the bones, and the other which are away, if they are extended, just like I am extending my arms. And there are bones: humerus bone, ulnar bone, radial bone, all these things, and the phalanges and the fingers. All these bones are having their two ends, two poles, you can say. The nearest pole, just like from the shoulder, if you count down, this bone humerus, which is united with the glenoid cavity of the scapula and makes a shoulder joints, that area is known as proximal end of the femur, and the other one is known as distal end, the same way as it goes farther. So the nearest portion from the body is known as proximal end, and the distal port and the away from the body is known as distal end. In this way, when the muscles originates, they originates from different places in a thread like. Different threads of the muscles originates from different places of the bone heads, and ultimately they go become wider, because after that the different threads unites and they form a delta that is known as belly of the muscles. It's a bigger site, and then ultimately when it goes to bind to the other end where the muscle is ending, that is known as insertion. And at that time, this insertion is converted into rope. It's not like the delta, because first end is just like finger like projections. All the finger like projections, different fibers are originating from one end. of the bone, mostly from the upper sides. Suppose muscles, just like these shoulder muscles, just the deltoid, the biceps brachii, and these muscles, they are unitating. They are originating in the shape of fibers, and ultimately they are united to the humerus. When they are originated, they are originated from different fibers, and ultimately those fibers are joining it, just like you see my palm. Muscle starts originating in the shape of fingers. Different threads, originates from the different places of the proximal portion of the bone, means the portion which is nearer to the center of the body. And ultimately all the bones, just like you see my bones, all the bone unites together, all together. When they unites, and just like my palm, you see that one. And in this way, when all the fibers unites and they are composed and filled up with the fats to unite with each other, this is like a palm, and that is known as a delta. And that is in muscle shape, that is known as a belly of the muscles. And ultimately these muscles develops, goes further and further. And they end up like a rope, that the fat portion remains backside, and after that the fiber remains in front, and then those fibers, as a rope type, they unite somewhere and bind one joint. So this is all over the body, and different bones are making a skeleton, and all the bones are united to each other. All the bones are united by the ligament, that is known as ligament of the muscles. When the muscles ends up, that is known as ligament. The previous muscles coming from backside are converted into rope, because they are ending over there, goes over the joints and bind it. And different fibers originating from that area also bind that joints, and then goes forward, make a belly, and ultimately converted into a rope, and that's ligament. And ultimately that also passes over the next joint. In this way, the body as a whole, from all the girdles, from all the big beam, you can say, just like when you make a house, you make pillars. You make pillars, and ultimately at the top, you join the pillars by a beam. So, as a beam, we have already discussed with you that this shoulder girdle, that's the beam. That's the upper portion, the upper beam of our body, which makes the upper portion of our trunk. Trunk means chest and abdomen. Trunk means chest and abdomen. The upper, just like chest and abdomen is one thing, just like you take it as a one thing, just like a home. As a home, and upper portion we have make a beam, or above the beam we are making the floors. So that's a floor. But there is one hole in our floor which goes to the neck. Okay, just like in the old homes, there were a gap on the roof, so that gases, when we are sleeping inside the home and doors are closed, the gas can pass out upward from these holes. Mug, that was called mug. Okay, so upper vent, you can say nowadays. This is known as vent. So from that vent passes, and from our trunk, all the blood vessels are exchanging with the head. So body skeleton is divided into head and trunk, and the middle area is known as neck. That is like a mug. That's a vent between the head and the trunk. And most of the gases here and there passes from this neck means just like the blood vessels and veins and arteries and nerves and food pipes and everything, many things from up area to goes downward, from down area to goes upward in this way. And all the muscles are binding all these bones. So these beams, yesterday I told you in my previous lectures, in the previous lecture of English, I told you that this break shoulder girdle, or the beam, you can say, easy to understand, is bounded by clavicle and manubrium sterni, which unites two clavicles with each other and up to the shoulder. Whereas from the back side, there is a backbone that is known as the scapula, and that scapula has a posterior tail of the scapula which jumps over the shoulder joints, and that is known as acromial process. So it means backbone, that is shoulder, front bones, that's clavicle on both sides shoulder, that's a scapula, are uniting and forming a cavity or sporting a cavity that is known as glenoid cavity, in which in which in this cavity our femoral head is inserted. Arms is united with the body by means of humerus bone, and humerus bone has a head, and that head is fixed into the that cavity and is bounded by the muscles which are coming from the back side. I will describe the muscles later on, because I do not want to complicate so that you cannot understand what I am talking about. So first of all, I'm just giving you the description that this body is constructed by the bones, and bones are united in a way that they forms a beam like structure which holds the pressure from upward. And then the vertebral column is a type of a pillar, you can say, which holds the beam pressure. Ultimately ultimately we were talking about the muscles at that time. So then all the muscles originates from the proximal portion of every bone, proximal portion of the bone, and passes over the joint where these bones are uniting with the extending bones, with the bones which are forming the distal portion of the arms. Means shoulder blade, shoulder joint, and the humerus. Humerus is a distal from our body. So this joints which are coming from backside, just deltoid, biceps, brachii muscles, all these muscles are passing over the shoulder joints and binding this shoulder girdle with the humerus, forming the shoulder joints. And that shoulder joint is formed in this way. And ultimately, this arms goes to the elbow joint. This is elbow joint, and the elbow joint has many other muscles which are inserting over here, passing this elbow joint, and many more muscles are originating from this area of ulna and the clavicle. Sorry, radius and ulna. So radius and ulna, these are two bones in our forearm. This is arm, this is forearm. So I will describe all the muscles so that you can understand. Nowadays, in my previous life, I think I explain in my childhood, when there is any breakage of the bone, when there is any dislocation of the joints, people were going to the persons who were not basically educated. They are just physically trained, and that training is also not well proved. But they, if ever joint is dislocated, They're just making here and there movements, and ultimately, if it's set, it's okay. If it's not setting, then some people are having diverted or diversion in their arms, in their joints, and in this way they pass on the life, because they were not known to the anatomical structure and formation, working of any joints, but they were just rotating here and there, and ultimately, if it is fixed normally, it's okay. If not, then sometimes your arm will not be in a state value as it was made by the nature previously. In this way, so we are giving this knowledge to you here, so that everybody should know that what type of joint, what type of movements can take place, and what are the muscles which are helping to take that movements of the joints normally. So just like I can just give you one example here, but this chapter we will deal with the bones only. Our chapter is today to deal with the pelvic girders, so I will deal with that one. Just like our shoulder can do circumductions. It can move like this one in a circle. It can go up, it can go down, it can go back up to limited circle, it can go into front. So these movements are made possible by a certain type of muscles which are originating from the back and also front of the chest. So they are originating from there, and I will tell you supraspinatus, infraspinatus, subscapularis, and all these muscles, pectoral muscles, they are uniting here and passing over the shoulder, and ultimately they bind the shoulder joints. In this way, there are many more other muscles I will describe later on, but I just want to give you the examples that this skeleton as a whole has two big pillars, sorry, not pillars, beams. They have big beams, or you can say it shoulder girder and pelvic girder. Shoulder girder and pelvic girder. These two type of beam, you can say. First beam is holding the body, this whole house, abdomen and chest. This whole house is under the shoulder girdle, and the lower house is making another portion, just like I told you in my previous lecture. That's this trunk as a whole, from shoulder to the hip joint, where legs are aparted. This whole is known as a trunk, and then this trunk is divided into two portions. First, two portion means one is called the chest, the other one called the abdomen. And this shoulder girdle is making a room, holding this area for this chest and abdomen. Furthermore, when we come to the abdomen, this whole abdomen, you can say this whole under the chest, you can say chest. Everybody knows that it is bounded by the ribs. We have already described about the ribs, and their description and everything has been told in previously about the true ribs, false ribs, and floating ribs, and everything for their joints. I have described that. But now come to after the chest. We are not talking about the organs in every different parts. No, we are just giving the description of the houses: chest house, abdomen house. These two houses were known as trunk. So trunk has two main holes, yet two main rooms. One room is known as chest, the other room is known as abdomen. And when we come to the abdomen, we say or we see that in the abdomen there are again to division. One division is known as abdomen proper, and after that, again there is a beam type thing which hold the pressure, just like one story room, a two-story room, a three-story rooms. So you can say this trunk is having three stories. The first story is a pelvic area, second story is abdomen, and the third story is a chest. And above the chest there is a beam which is holding upper roof, having a hole of neck by which the blood vessels and all other necessary things are passing from head to the trunk and from trunk to the head. And now, when we are saying that abdomen proper, in front we see the chest, in front we see the abdomen, and when we come to the abdomen, and I told you it is again divided into two portions. One is known as abdomen proper. The other portion is known as pelvic area or pelvic girdle, you can say. Pelvic girdle is bounded by different bones so that they can hold the organs in between the pelvic area. And also, there is a not only the outwardly, there is a description or division internally. Internally, the abdomen proper is divided by two portions by the peritoneal coverings. There is a big covering. All the organs of the trunk are basically the abdomen are covered by a membrane known as peritoneum. And this peritoneum has two portions. One portion is a bigger portion, which is known as greater sac of peritoneum. And the other portion is known as lesser sac of peritoneum. All the organs which are situated inside the abdomen proper, they are all covered by this greater sac of peritoneum. And the lower sac, that is a separate sac, though it's of same constituency, it's the same formation, it's the same type of membrane, means the same cloth. We have one blanket and the other blanket. One blanket is covering all the abdomen organs and the other blanket is covering all the pelvic organs. But it's a type of covering, double layered covering, in which all the organs of the abdomen and all the organs of pelvic area are wrapped up, you can say. They are all wrapped up into that. So we are discussing about the still skeleton structural formation, bony formation of the girdles, means the beams. So first beam I told you about the shoulder. The second beam I'm telling you about the that's known as pelvic girdle. And in this pelvic girdle, the main beam, vertebral column, main beam which is going inside our back from skull to downward up to the coccyx. The latest portion, last portion of the vertebral column, it goes downward. And this pelvic girdle and the shoulder girdles are little different from each other. The shoulder girdle, I told you, is bounded by bones in the backside and bones in front. The back side, there was a scapula on both sides, right scapula and left scapula. And in front of the chest, there is a clavicle, right clavicle, and left clavicle bone, and in between a bone which is uniting these two bones is manubrium sterni. Whereas when we are talking about this pelvic girdle, there is no such beam, especially having this type of structure, but still it is considered as a girdle because one bone of the hip joint or the pelvic bones is uniting to form a beam. That's the pubic bone. When from the abdomen, from your navel, just in the middle from the navel, if you if you press your abdomen downward, ultimately you will see a bone, hard portion. That bone is a union of two bones, unite or joint of two bones. These are known as symphysis pubic bone, and the union which forms this joint unite these two bones. In between that there is a disc, and these are united with these two bones, and it forms a girdle. Same type of beam, but it is a different type of beams. In the back side there is a vertebral column. In the back side there are some other bones, just like the sacrum and the oxys. Coccyx and sacral are united bones. Ultimately, they start uniting after the 20 years of age. And in front is a pubic bone, which originates from these areas in combinations and unite in front to make a circular type of cavity. Basically, it's not a proper circular, it's a oval type of cavity, you can say. The oval type of cavity. Again, again, further, for the purpose of functioning and the responsibility of this bone, of this pelvic structure, we have divided this cavity. So let me describe first of all the cavity. So in the back side, I told you there is a vertebral column which is coming from the skull. And when it comes to the pelvic girdle, it is supported on both sides by the different bones. And those bones are a high up bone where you put your belt. If you press on right or left side of your upper high up bone in the abdomen on sides, that is known as ilium. That bone forms the upper, just like Himalaya forms the upper tail, upper thing of our this India. In this way, from our abdomen, I want you to be clear what I am saying. From abdomen downward, if you press in front, you see a bone that is known as symphysis pubis. Pubics are two bones. When they unite, they form a joint. That joint is known as symphysis pubis, just like the shoulder joint I told you, or just like the manubrium sterni I told you, clavicle joints. In this way, so in front, there is a symphysis pubis joint which unites two pubic bones, and on the sides. And on the sides, the high up, when the soft abdomen finishes, if you press the abdomen is a soft, and after that, if you dip down and press that one, you will see bone on the both sides. That is the bone known as ilium bone. And this ilium bone is also a forming the part of the globe. It's a round forming or taking part in the globe. And the top of this ilium is known as iliac crest. And there is a one tubercle on the iliac crest, where there is a some ligaments, because wherever there are tumors projected on the bones, nature has made these tumors and bones projected from the normal bone just to bind up some ligaments, just to bind up some ligament to support the structure from the other areas. In this way, this is a iliac tuberosity, the high up top area, and this is on the top of the tail of the ilium bone. So this forms the side globe of the pelvic girdle. And where we are sitting, just like I'm sitting on the chair. I'm sitting on the chair, and the bone which is touching with the chair is known as ischium. And it is also a globe type. It's also taking part to form a globe. Ilium on both sides, right ilium, left ilium, is forming a globe, upper portion of the globe, and from the lower portions of this globe is formed by the ischium. And ischium and ilium. Ischium and ilium. Ilium is the topmost bone of the pelvic girdle. Ischium is the lowest bone of the pelvic girdle. These are structured in a way that they form the part of the globe, round, but it's oval type. And ultimately, these two bones are supported by, in the backside, by the sacral vertebral column beam that I told you, the main beam. Main beam, the root of the beam is a coccyx, and upper portion is known as the sacral. So this coccyx and sacral in the backside, they fill up the gap between ilium to ilium, fill up the gap between ischium to ischium, so that the backside of the pelvic is also a bony structure. And they are structured in a design that they form a globe. So now I told you that the backside of the pelvic girdle is a totally bony structure formed by sacrum and ilium, and also the sacral plexus, sacral bone, and the coccyx bone. So all these bones from the backside are taking part to complete the pelvic globe. Now there is a front side. There is a front side, a bone originating from the joint of these two bones, ilium and the ischium, where they unite at the same time, at the same junction. Another bone originates, which goes in front of the pelvic area. This is what I told you. If you go down from the umbilicus and go down, ultimately you touch a bone, just like where you put your belt, buckle of the belt. Buckle of the belt, you see that it is just above the symphysis pubis. And these two bones, the pubic bone, unites in front to complete the globe, oval type of globe. So again, I can repeat so that you can understand. In the back side, from upward to downward, the vertebral column is coming down. The vertebral column is converted into sacral bone. Under the sacral bone, there is a coccyx bone. They form a gap between the ilium and the sacral bone, so that from the back side, our hip joint is completed into a globe, the bony structure. And in front, how they are united. In front, how they are united? They are united by the pubic bone. And that pubic bone originates from the junction of sacral and the ilium bone. and goes forward, projected forward, and they are united forward. Just like the clavicle, I told you, on the shoulder goes from front to the shoulder, and in the back side, the tail of the scapula goes upward, also come to the shoulder joint, and they unite and form shoulder joints. In this way, the originates this pubic bone originates from the junction of sacrum and the ilium bone and projected forward. It goes forward and unites in front of our abdomen, you can say. The lower portion of our abdomen, they unite it. Now, the special thing which I want to tell you, that the underneath portion of the pubic bone and the upper portion of the pubic bone is open. Back side is covered by the ilium. Lower portion is covered by the ischium, and the gap between these two, right ischium and left ischium, right ilium and left ilium, they are not uniting directly with each other. No, they are not. In between, just like this Menubarium sterni, I told you in front of the chest, to unite these things, because they are having gap, they are distance. So to fill up that distance, the upper pillar is going downward of vertebral column, and the sacral bone, which is formed by 5 different vertebrae, and the coccyx bone, which is formed by 4 different vertebrae. 4 and 5, I'm telling you, because they are converted into one bone. But even then, I'm naming them separate. It has been separated, named in the anatomy, because every vertebra has their different openings to pass the nerves from vertebral column, neural canal, to the other organs, to for their normal functions, for their sensation and function, sensory and locomotory power they are providing. That's why their name is different, coccyx. Otherwise, we can ultimately say that this is one bone. No, it's not one bone, because the different nerves are originating, and to identify those nerves, these are coccygeal nerves. What they are doing, these are sacral nerves. What they are doing, I have to describe separately to you when I will discuss what are the organs inside the chest, what are the organs inside the abdomen, what are the organs inside the pelvic area. So I just told you about the pelvic girdle. That pelvic girdle is formed by these bones, and the folly is that this girdle is formed. Backside it is completed wall, but in front it is open from upward and open from downward. Downward, there are some muscles which bind the floors, and upper portion is covered by the abdominal wall. Our abdomen is also open. It's having no bone in front. It's having bone only in the back side. But in front, it is bounded by musculatures. There are 3 type of different muscles: transverse muscle, or oblique muscles, and circular muscles. These 3 types of muscles are making and all these muscles are passing over the symphysis pubis and also going downward. In case of females, the female genital organs mainly are in between the pelvic cavity, but vulva, the outer portion of the female organs, is visible and formed by these muscles which are going from the abdomen to downward and forming the labia majora, labia minora. And also in the male side, the penis, and our testis, all scrotum, you can say that they are also of the same structure of muscles which are coming from abdomen to downward. Abdominal muscles go downward and unite in the middle. There is a suture. You can stitching in nature has made that. Right side abdominal muscle go down, left side abdominal muscle go down. In case of a female, it makes a gap in between, that is known as vulva. In case of a male, it sutures this thing, and makes the scrotum where testis lies, because the male testis lies outside of the abdomen and the female ovaries lies inside the abdomen. I told you many times, because eggs needs more heat to hatch out, whereas the sperm needs less heat, even cold area, to develop into a normal structure. Therefore, nature made a separate gap bag, you can say, different bag inside the abdomen. Abdomen is over, above that one. They are hanging. This bag is hanging down the abdominal wall, that is known as scrotum, and nature has stitches right wall with the left wall. And if you see your testes, scrotum outside, they are stitched inside in the middle. They are having a suture. Nature has stitched these things so that it can become a proper bag to hold the both testes, right testis and left testis. They are holding inside that one. They are lodged there. This is known as lodging. So they are lodged inside the scrotum, whereas in case of females, this suture is not stitched. This suture is not stitched, because forming the vaginal opening, forming the urethral opening, whereas in case of a male, the urethral opening is outside through through the penis, and also the semen discharge is also through the urethra, and they are outside from the abdominal wall. So in this way, nature has made separation from the male to the female. Means there is no suture there is a gap in the sutures in case of females, which ultimately is known as vulva. And vulva has vaginal opening and urethral openings. Okay, and in both the things, in both, the backside portion from this junction is known as, from the scrotum and all that, between this area, it's a, you can say, diamond type of area, just like you see the diamond. Or because it's not a square type, it's not a circular type, it's a different kind of area in between the vaginal opening, lower opening, and the anus, or in case of males, under the scrotum up to the anus, is a separate area which is known as perineum. Perineum. And I told you about that one previously as well, but I'm repeating it now. This perineum is a junction box. Just like every home has a electric connection. Electric connection is passing from our inside home meter, from where all the lines to our home or different rooms goes, and we can use the electricity in every room, fans or whatever we use. There is a meter. In this way, this perineum area, I just want to giving more stress on this thing, that you should understand. Previously it was not learned, that what's the purpose of this perineum, why the nature keep this gap over there under the lower end of vagina, or under the lower end of scrotum, means where the testes, in the case of males, testes are lodging. From that area up to the area of anus backside, up to the area of anus, there is a space, very secret. Very secret, nature has fixed it because it's an important thing. It's an important thing. And this area is a special area where there is a junction of nerves which control all the female genital organs, their functions, their abnormalities, and everything. The same way, this area is also controlling the function of male genital organs as well. And moreover, it has been learned nowadays that this area is also responsible for stimulating the sexual activity in male as well as in female. You might have noticed, yeah, because when we work in the society, when we work in the hospitals, medical colleges, and as a student or we are teaching, and that's a different nature. That's a different nature, and all these things which are considered just secret, and do not talk like this one. It looks like vulgar we are talking about when we are talking in an open society, but in the medical colleges as students we have to teach this thing to everybody, so they should know what is the importance of this thing. So but here we are teaching here, so that's why everybody will be interested in knowing all these things, that what is the purpose of this premium, why the gap, no man's land. Basically, it's also a no man's land. It's not area concerned with the anus. It's not area concerned with the genital organs, because male and female genital organs are above this one. Anus is back to that one, but still there is a gap. It's not with the rectum, anus. It's not in the part of the female or male genital organs. So what's that? That's a perineum, and this perineal area is also stimulating the sexual activity in both the sexes. During sexual activity, the scrotums forcibly, regularly stroke this area, and it stimulates his own erections, as well as it stimulates the female stimulations in sexual activity. Plus, there is a junction box, and it has a nerves which are controlling the activities, just like ladies are having abnormal menstruations, just like there is a uterine problems and all these things, and even the pain, serious, everything. So all these nerves are having a junction box over here from where we can control it. You might have seen that and when there is a labor now, it is in routine. Doctors are doing cesarean sections, eh? And they are putting injection in your vertebral column in the backside, in the lower portion, the sacral section, in the that's known as sacral area, where there is the fifth lumbar vertebra and the first sacral vertebra are uniting. It's a big gap. There is a big gap, and doctor generally insert the needle in that area, and they give some type of injections, interarticular injections, so that the lower portion, total lower portion, will be numb. Why? Nerves are originating from here, going to the perineum, and from there they are distributed to the testis, to the vagina, and all, there are many more structures in the vagina. We will describe it later. So all these things are controlled by this thing, and then doctor do surgery on the abdomen. This area is covered with that one, and then lady do not feel it. She's watching everything, though what the doctors are doing, she can see the faces of the doctors, but she cannot see because she is lying. She cannot see what the doctors are doing in my abdomen, because she do not feel pain. All that area becomes numb. So I just saying this thing, I want to convey this thing, that this perineum is a more important area to control all the functions and sensation of the pelvic organs. ovary, fallopian tubes, uterus. In male side, controlling also the bladder as well. In male side, it's controlling the prostate, it controlling the urethra, erection of the males, and all that. So in this way, it's a more important area of the perineum and playing a big role in our life. So this is the pelvic girdle as a whole. Pelvic girdle. Again, in a few minutes, because our time is going to be over, in a few minutes, I want to repeat what I told you. The first of all, I described about the shoulder girdle, beam which is above our body at the shoulder level. So that's formed by clavicle on both sides, and these clavicles are united with another simple beam, short beam up to the chest only, and that is the manubrium sterni, or the part of the sternum. And from the back side, this pelvic shoulder girdle is supported by the two scapulas, right scapula and left scapula. That's known as scapular blade. And ultimately, the joint is formed. In this way, in the lower portion, we are discussing about the pelvic girdle. The pelvic girdle is formed by the backside. On the sides, it's ilium bone. On the lower portion, it's ischium bone. And ischium and ilium bones in the backside do not unite with each other. Just like clavicle in front, they do not unite. There is some piece of the manubrium sterni which gives power with unite two clavicle bones. In the same way here, these ilium and the sacral bones, which form the backside of the globe of the pelvic, do not unite with each other. In between that, to unite right ilium with the left ilium, right ischium with the left ischium, nature has fixed the upper beam. Just in between the walls, you might have seen a pillar is going upward, and on both sides we make the walls to make the house. In this way, this beam is vertebral column. So that beam is covering that gap by the name of sacral area, by the name of coccygeal area. So this backside and both sides of the pelvic globe is covered by all these bones. And in front, it's open. We have to make a door to go out from the home. In the backside, we do not go, but in front, we need the door to go out from the home. In this way, the front side is covered by a veranda that is made by the muscles of the abdomen, and sunshade. Mostly you make sunshade on the windows and on the doors and all that, so that the rain cannot go inside it, it go outside. In this way, nature has descended these abdominal muscles downward from the symphysis pubis, because the symphysis pubis is coming from ischium and the ilium, ischium and the ilium bones, where they unite each other at the same gap. This ilium bone, sorry, the pubic bone is fixed. This pubic bone is fixed in front. When they unite, that is known as the symphysis pubis, and abdominal muscles pass over pubis, pass over symphysis pubis, and they are sutured stitches downward. And that stitching is not perfect. In case of females, it is open gap, and which makes the vagina and also the urethra in the females, but it is stitched. Even you can see your penis, there is a stitching in the backside, and it's also stitched in the backside. Penis, the musculatures of the skin on your penis, if you see underneath, it's stitched. And those muscles coming from the abdomen, they are stitched over there. And the same way, a muscle is descending downward to make a gap, bag, where testes are there. How the tests go over there, I have told you many times, but again, I will tell you when the time will come, because we are giving you a series of lectures, like just like a katha. You go to a mandir, you go to a gurdwara, and you listen the katha, and I'm giving you this katha of our life, katha of structure of this body, so that systematically you can learn each and everything normally. It's not that complicated that you should not learn it. No, if you learn this one, it will be easy for you in your life. If ever any complication comes anywhere, you understand what is the function of this one, and how you can remove this function, obstacles of this function, or any problem in this function, by rotating your body, by moving your body, by your exercise, and all these things you can do normally. So this is what I'm telling you. In front, when symphysis pubis joint is there, over and above that joints, our abdominal muscles pass over that and make a gap for the urethra, and this is united, the penis, and underneath there is a gap, and those gap is united, means making a bag type, that is known as a scrotum, and this is also stitched. Nature has stitched it, and to hold the testes outside. I told you why nature has made this thing. So I think this is over for today, and tomorrow this lecture will be in Punjabi. If ever anybody listen today and needs to understand more in Punjabi, yeah, they can join us tomorrow at 5 to 6 California Pacific time, and I will be delivering this lecture in Punjabi tomorrow, so that easy understanding. So I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N Court, Dublin, California 94568. My phone number is 408 687 1899, and email address is homeomedicine, HOMEOMEDICINE at yahoo.com. If you cannot call me, you can send your question in email and I will answer you. Whenever you are tired of any treatment for any disease, to get your second opinion about your disease, or if ever you are tired of any treatments and you want to know about your process of treatments, why there is a hurdles, why you are not getting cured, I can tell you the nature's process. What's the nature's process in your disease, how it will be cured, and if it is curing, what will be the pathway of this cure. Everything happens just like if you come to my clinic, you pass many cities, many exits, and ultimately when you go back, you will go back on the same road, and the exits which you were passing previously will come in the reverse order. So this is what I can tell you, because I know about the body, each and every cell of the body, that how it works, how it becomes sick, and if it will recover from disease, how, what will be the signs of recovery, how I will kind of feel that yes, now it is recovering, and we can wait with that treatment. But if your treatment is not going in a proper way, not according to the nature's way, then I can guide you what to do and what not to do. So, Rab Rakha, God bless you all. We'll see you tomorrow in our Punjabi lectures. Sat Sri Akal, Adab, Namaskar.